April, I'm going to be condensing a 90-minute presentation into about 15. So we're going to move through these slides very rapidly. I do want you to know that I would be available, as any of us are from the Citizens Advisory Group, for longer personal presentations. If you have a class or a community group and you'd like us to come visit and present on an extended basis, we're available to do that. I make these presentations on a regular basis from the county health rankings and roadmaps. They're completed through the University of Wisconsin Population Health Institute from funding provided by Robert Wood Johnson Foundation. So the background of the county health rankings is that it's been released since 2009. I have been the state representative for Arkansas for the county health rankings since that time. And why do we bother to rank county health data? Because it really works to simplify that complex data, and it draws attention to community health issues, and it also allows for the full community to engage. So measures are selected because they're actionable. They're things that you can actually do something about. They're valid, reliable, recognizable, and they're at the county level, and they make a determination that oftentimes fewer measures are better than many, so that, again, we can condense that information to something that we can understand easily. So accessing the website takes you to this Action Center, which is new this year, but I'm particularly fond of. With the cycle of community health improvement, you can come in at any level to either work together, assess needs, focus on what's important, choose those programs, act on what's important, or evaluate. You might find some semblance to the scientific process. We make that hypothesis, we do our testing, we evaluate, and then we continue the process again. I particularly focus on assessment. I have professionally worked, I still professionally work in community health assessment activities, and I feel as though that this is vitally important. It's a cornerstone of public health. Any activity, it always behooves you to do a prior assessment before you start to implement with limited resources. And so you'll see under these key activities, the first suggestion is to review your data, generate your questions, and then collect additional data to try and help answer those questions that are proposed by the community members. And so just so that you know that I have been actively involved in this isn't a new subject matter for me. This is the logic model that county health rankings are based upon, and it states clearly that policies and programs have an effect on health factors. Health factors have an effect on health outcomes. There are two rankings provided by this model. One is based on health outcomes, that is both the mortality or length of life and morbidity or the quality of life. Those health factors are based on those four areas: personal health behaviors, access to clinical care, social and economic factors, and the physical environment. So these are the two rankings. Health outcomes represents today's health. Health factors represent tomorrow's health. So mortality and morbidity, how long we live, how well we live. This is an overall map that shows Faulkner rated number 3 in the state. We only come in after Washington and Benton counties. So this confirms that this is an area with access to resources and overall high quality of health. Those health factors relate to these four areas that I've already discussed, and it predicts tomorrow's health, and Faulkner does even better, second in the state. That is impressive. The data that I'm going to show those slides, again, I'm going to go through really rapidly, but I want to talk about the fact that the national benchmark is like the A grade for the rest of the country. 90% of all counties fall at that level, so it gives you something to compare. Without a comparison, a lot of data and statistics don't make much sense. So out of that 3, it shows you here that we are 3rd ranked for mortality. Premature death is calculated on years of potential life lost. That's a kind of a big epidemiological methodology to calculate the average lifespan and then subtract the actual age at death, and then all those years combined equal that total of the 7,296. If you go to the website, you can actually click and see the trend over time. Morbidity is not quite so good. We're looking at 11%, and I invite you to look at the 18% of our community that have poor or fair health. And because one of those things about reliable and validity and used by others is that you can compare and contrast data not only collected locally but collected nationally and then processed back to a number that you can use. And then this talks about the health behaviors. Our rank again is a little bit lower at 6. Our smoking and obesity are quite high. A third of the population is actually obese in Faulkner County according to this ranking. Always put in the note about the sexually transmitted infections. You see that? That's 423 out of, that's the incidence of chlamydia per 100,000 population. So that's pretty high here compared to the rest of the country, all across Arkansas. Clinical care, this is access to care. You see we are real heavy in primary care physicians. Access to care is not an issue in Faulkner County. Although our preventable hospital stays, so we have lots of doctors that like to send us to the hospital, that kind of makes sense. Social and economic factors, we have a high level of community members with at least some college. Everything else is pretty much in line. Those numbers about children in poverty and children in single parent households are a concern to me, but again, those are statewide issues. So the physical environment, this is something that really stands out to me. 1 in 4 of us that live in this county have been subjected to a drinking water safety violation, and that is something that we should work to address, and that's part of the Citizens Advisory Group efforts in the Fayetteville Shell. This is a little bit of information about that data point so that you understand where it comes from, and this is a great reference. It provides the resources. Here is a link to a page on the Arkansas Department of Health that provides access to many other county-level data sources. So they're in one place. It's easy for you to find and access that information. So moving into the Mayflower situation, you can really think of an oil spill as an evolving event. There are those acute impacts, like the wool birds. But then, and she says that the acute effects are fairly straightforward. I don't necessarily agree with that. I think that there is a lot to still be learned about the acute effects, but certainly the chronic effects are definitely tricky because they do require that monitoring over a long period of time, and we have to get started somewhere. This is the official evacuation zone that included 22 homes in the Northwest subdivision. As you see, it's very limited, and in some places there's actually no buffer zone at all. I direct your attention to the bottom edge. You see that those that buffer zone backs right up to where the spill area is. This next shot is a little bigger, it gives you a little bit more. But even during that zone, the shopping strip mall where the Subway and the grocery store is, that was used as a work site, and there was constant vacuuming going from the drainage ditch, but there were still people in and out of the restaurants and the grocery store throughout the entire process. This yellow dotted line is the path of the pipeline. You can see the purple line. I know it's hard to see because you're kind of far away and it's not a great graphic, but the purple line shows the path of the oil. And there were no evacuations any otherwhere except for voluntary, mandated evacuation. It was only that very, very limited area. So with a comprehensive community health assessment, some of our first priorities are going to be our first responders, the cleanup workers and the law enforcement officers that have frequent, intense, and the longest duration of exposure to the crude oil. I'm sorry, April would correct me on this, and the air quality concerns. The personal protection equipment requirements and availability, the extended working hours, the accident and injury rates, the transfer of those hazardous materials to the community via laundromats, restaurants, the gas station and car washes, and other retail establishments. We saw workers wearing their work clothes, the coveralls and the boots that were still heavily oiled, entering a number of retail establishments. The vehicle and equipment traffic, those hazardous materials, again, are going to be transferred through the tires. You run the vehicle through the spill and it's on the tires, it splashes up on the vendors. When they wash the equipment in the cars, it's got to run off somewhere. There was obvious unsecured and improper storage of the holding trailers. There is an ongoing battle about that in the court. The wear and tear on the roadway, the idling, the noise, and the exhaust from occur, there is still a re-entry into the atmosphere of some of those volatile compounds. So along with this, other areas that need to be really looked at closely and addressed would be the children. A lot of times kids are outside playing barefoot, or if they do have their sneakers on and they get some of this material on it, how often my kids used to always keep their shoes off underneath their bed. So that material stays on there and continues to off-gas while they're sleeping over top of it. That again would provide another avenue for extended exposure. They have increased metabolism. They're closer to the ground. They do less hand washing, and they're more likely to put objects in their hands and mouth. And the proximity of the school playground to the spill zone is absolutely amazing to me that those children were allowed to have that level of exposure. Senior citizens, there is a large contingency of senior citizens in the area. They're home more often. That increases their exposure because they're not moving to go to work. They have an increased rate of chronic disease. They may be in a wheelchair that would have the same effect as the tires of the vehicle or a bicycle. Veterans, we have veterans living in the area. They would have prior exposures that again would make them more sensitive to either Agent Orange or the Gulf War syndrome. A lot of those type of symptomologies would be congruent. Pregnant and breastfeeding moms, two populations that so badly need to be protected. And then pets that run around loose outside. They put their paws in it, it gets on their fur, they come in contact with other wildlife, trash foraging, roadkill cafe, some animal that's died because of being oiled or being affected by the cleanup or remediation process, and then the dog finds it and eats it and then brings that back home to the children and the household. There's lots of farm animals. There's a rural area. And then the bioaccumulation with wildlife, the disruption of the nesting and the spawning seasons that hit at the high time of spring for spawning at some of the game fishes in the lake. And we've had multiple reports of dead and damaged fish. We've seen fish already with oiled gills and sores. And when the bacteria, insects, and vegetation die off, that affects the very foundation of the food web. And we'll see long-term repercussions from that. So technology advances over time. I love this slide because looking at your cell phone, how much have we changed in just this short period of time from 1992 to today? And yet we're still relying on the technology of paper towels. And I don't think that that's appropriate or effective, and I'm sure many others agree with me. Evidence-based science matters. To be scientifically supported allows us to make smart investments, guide our decision-making, and inform innovation. So a chemical exposure assessment, this is a very simple graphic of that, but there's the 4 steps. You have to identify, look at the dose response, the exposure, and then risk characterization. So this would be also part of that comprehensive community health assessment because this would help identify those sensitive populations and allow us to have a better idea of how adverse the effect might be. So the Arkansas Department of Health made these oil spill health assessments available, and I was one of the ones that went through and completed this myself. You can see the press release sheet that was provided of these, and you can see that the reason why is to connect individuals to appropriate healthcare providers. And I will share with you that when my assessment was complete, I was advised to go seek medical care. So I think it may have saved us a lot of time just to tell people to go see a doctor, not having availability to doctors that are skilled or experienced in occupational environmental medicine causes a conflict. That's an issue that we need to address. So this is something I picked offline about how the telemedicine assessment works, and you can see that she's got a handheld device, and actually I was okay when they stuck it in my ear, but when they wanted to put it in my mouth or up my nose, I became very uncomfortable. I felt like it was just incredibly too invasive. And you see, as this one has here, there's no sort of protective plastic covering. There's many components. I'm concerned from what we know about dental equipment and medical scoping equipment. We have a history of bacteria and disease being transferred through these type of equipments, and I have concerns about this and the possibility of that here too. Made me very uncomfortable. So one of the first questions access resources. And health is really more than healthcare. Many factors contribute to health. Health is everyone's business, and it really takes all of us, each and every one, to work together to improve the health of the community. So we were able to complete this Mayflower Rapid Community Health Assessment, and later in the day, we're going to give you the results of that. But our assessment shows the potential for greater than 90% of those homes in close proximity to the pipeline rupture to be adversely affected. 90%. So thank you. If I have time, I know we're running a little bit late. I have a short video I'd like to show. Dr. Mason, are you okay with 5 minutes, or do you want to get started? Okay. And part of the reason why I'd like to show this video is because it gives you a little more insight into the history of Faulkner County Citizens Advisory Group, and it also includes some previous members.
Decide to seek the truth. What will be tomorrow's outcome?
Defining
If we decide to seek the truth, what will be tomorrow's outcome?
defining community is as easy as defining wealth. You have an idea. You really don't know what it is until you get there. So you drive towards it, always chasing, and never realizing that the true purpose and power of community is love. The wounds of the world can be healed with this realization. One has to work within their own community with purpose and dedication to steer the world closer to global change. My community is routinely near the top of county health rankings. Much of this is due to access to higher education. Half of our community's population resides in Conway, the city of colleges. Conway is also home to a healthy hospital system and fire department. However, the rest of the county is rural, has a lower socioeconomic status, and much fewer resources. The county health rankings do not reflect the unique conditions in these parts of the community, particularly in northern Faulkner County, the gateway to the Fayetteville Shale. Because of recent development by the natural gas industry and a controversial practice called fracking, the physical environment is a major health factor. We face many challenges, including environmental contamination from a poorly regulated industry and a county government that is hesitant to take responsibility for the health of the community.
Call this meeting order. This is the final committee of the county. Courts and public safety.
Assessment is one of the core functions of public health, because before you can implement with limited resources, you have to assess.
I'm not saying the benefit to the county government, not the benefit to the county population, but to county government.
Thankfully, there are some community members willing to take on that responsibility. Faulkner County Concerned Citizens Advisory Group, or CCAG, began in 2010 in response to the recent earthquake swarm.
There's a whole lot of shaking going on in Arkansas after a 4.7 magnitude earthquake.
Nearly 6,000 people reported feeling the quake in more than 600 zip codes.
A whole bunch of natural gas exploration there, and they inject fluids in there, and that's been shown to kind of lubricate faults and cause small magnitude earthquakes.
And without hesitation, we began to engage the community in all hazard preparedness activities.
Doing everything we can to better prepare the school and assist Mr. Spanger and the faculty here at Greenbrier in preparing for any type of disaster, but more specifically earthquakes.
After 1,000 plus earthquake pressure or CCAG and clear evidence, the Arkansas Oil and Gas Commission created a permanent moratorium on disposal wells in northern Faulkner County. The moratorium was the first step in preventing a future disaster. However, this fault could produce a 6.0 magnitude earthquake. This is one more reason why preparedness is a key component of our mission. Some of our other accomplishments include removal of hazardous material sites, ongoing research with Cornell University to determine the health effects of fracking on local animal and human populations, and a documentary film that aims to expose regulatory problems on a local and state level. CCAG is also committed to engaging in an ongoing evaluation process and will continue to set the example. If not us, then who will take on the responsibility to ensure the good health and vitality of our community and our home?
So thank you for your attention. I hope that gives you a little better idea about who Faulkner County Citizens Advisory Group is and what some of our efforts in the community have been. And actually, that documentary, the first section, has just recently been released. Emily Lane is our resident documentary filmmaker, and it's specifically focused on the earthquakes that are related to the injection of the fracking flowback water. That being said, I'd like to introduce our special guest today, Dr. William Mason. He graduated from the University of Arkansas at Fayetteville with a Bachelor of Science degree in zoology. He received his medical degree from the University of Arkansas School of Medicine. He's completed an internship in surgery at the University Hospital, followed by a residency in internal medicine and a fellowship in pulmonary disease. In 2009, Dr. Mason completed his master's in public health at the UMAS A.W. Bozeman College of Public Health. He's a board certified in internal medicine with a subspecialty in pulmonary disease. Dr. Mason served in active duty as a captain in the Air Force, where he was a flight surgeon and the Strategic Air Command Chief Medical Officer at the McCoy Air Force Base in Orlando, Florida. Dr. Mason has served as a clinical assistant professor of medicine at UMAS and an adjunct professor in the Department of Environmental and Occupational Health and Epidemiology at the UMAS College of Public Health. His current teaching schedule includes disaster preparedness. Dr. Mason was the Vice Chief of Staff at St. Vincent Infirmary Medical Center in Little Rock, where he also served as the chair of the Institutional Review Board. Since 2002, Dr. Mason has served as the Medical Director for the Emergency Response Section of the Arkansas Department of Health. Since 2005, he has been the Section Chief for Emergency Preparedness and the Associate Director for Science for the Center for Health Protection. He is a member of a number of professional organizations, including the American College of Physicians and the Arkansas Public Health Association. He has received a number